The Tata Group can transform the world health sector. In 2020, the Tata Group has constructed a 540-room hospital at a cost of 60 crores and handed it over to the government of Kerala. Operating costs, including hospital equipment, are borne by the government. Imagine turning this miracle happened at Kasaragod in Kerala into a business model. Imagine becoming the first PPP model to change the face of the world health sector. Allow them to collect the room rent from the patients in the same pattern as the Tata Group collect room rent from their budget hotels. Since the running costs are borne by the government, the hospital can be run ensuring moral standards without any unnecessary examination, medication or surgery. If this is done, it will be the no-bill hospital mentioned in the UDF manifesto led by the Congress in the 2021 Kerala Assembly elections. This is the culmination of the Right to Health plan announced by Rahul Gandhi in his 2014 and 2019 Lok Sabha manifesto. The Deccan Herald has published a report of 78 service-oriented doctors in India on March 6, 2015. It was a direct reflection of the greed of private hospitals in India. According to the report, the health sector in India ranks second in terms of corruption. The first place goes to the police. Following this, a report published by the Mint 3 years ago states that the profit margin for private hospitals in India is 1,737%. That was the report of the National Pharmaceutical Pricing Agency. It is amazing that a leader like Rahul Gandhi announced the Right to Health plan in 2014 in India with a clear vision to elevate the deplorable health sector. It can only be done by an honest leader who committed to 130 crore people. It is also hopeful that Congress leaders like Jairam Ramesh and Shashi Tharoor will support this. This would make hope of the Indian people that there are still leaders who follow the vision of Mahatma Gandhi. The Tata Group should provide Kerala with a credible hospital like the Vellore Christian Medical College. Ask the government to provide the land for free. A Muslim brother has given 30 acres of land to run a free hospital for Davis Charamela Chand. Perhaps it can be used. Assign the budget brand of Indian hotels to prepare the physical conditions of the hospital. Manage it like a Tata Group hotel. Provide a grant from the Tata Trust for the cost of hospital equipment and the salaries of staff, including doctors. It may cost around Rs 75–150 crore a year. Run the hospital by ensuring the Tata Group earn trust in the public. Here the cost of treatment for patients can be reduced by 1/30 or 3.3% excluding room rent and medicines. In fact, Kerala needs 3 such hospitals at 150 km distance intervals. Between Kottarakara and Adoor in South Kerala, Central Kerala, and North Kerala. If the Tata Group launched at least one hospital, the same would be followed by the help of Infosys Foundation, Azim Premji Foundation or Shiv Nadar Foundation. If such an institution is started in Kerala, the same demand may arise from other states and the operating cost may be shifted to the system provided by the government. Indian hotels may also open a new category for hospitals. In addition to having a reliable hospital, it has some advantages. 1. Government hospitals, medical colleges, will be forced to renovate themselves, including the approach to patients. 2. Existing private hospitals will be compelled to maintain credibility. 3. There will be a reshuffle of the government health budget and public sentiment for the implementation of this model will rise. 4. The cost of providing basic facilities to hospitals will be eliminated by the government forever. Government land will be transferred to government-private PPP system. 30% will be fully government hospitals and 70% will be public-private sector. This will lead to free treatment for 130 crore people in India. It was in 2011 Kumbanad Valley Yil Santoshvi George explained to Malayalam Manorama editorial director Thomas Jacob about the right to health concept in detail. This was discussed in the Tomorrow Kerala Idea Fellowship held in Kochi in 2013 by Malayalam Manorama. For the first time in India, the then Kerala Chief Minister Chandi was the first in India to demand that health should be a right. Urged the Tata Group, which has its reputation of ensuring trade ethics, to implement this health scheme in India and abroad. Indeed, this would convey Indian spiritual heritage of health for all. The nationalization of Spanish private hospitals to control the COVID-19 widespread in Spain and their meritorious servings can be seen as an illustration to envision the merit of this scheme. May the Tata Group be able to bring peace to 130 crore people in India and give a new hope to humanity.